In today's video, we'll discuss about erythema multiforme. So it is usually asked as a short note in papers, and it is also very important to know. So let's get started. First of all, we'll start with the definition of erythema multiforme. So basically, it is a self-limiting dermatitis characterized by a distinctive clinical eruption manifested as iris or target lesion. Now, in other names, it is usually called as the iris or target lesion, or even the bull's eye lesion. Now, I'll tell you why is it called this in the clinical presentation. Now, in classification, it is divided into three. The first one is the erythema multiforme major, then erythema multiforme minor, then we have Stevens-Johnson syndrome. Now what I want you to remember, now over here M, alright, and it is major. So what you will see is there will be mucosal erosions, of raised lesion. Now here M, it is minor. So what will you actually learn by it is you will see that there are more skin lesions and the mucus involvement is quite less, or it is not there. Okay. Now Stevens-Johnson, toxic epidermolysis or epidermal necrolysis. Now in precipitating factors, either it will happen due to some drug, like NSAID, sulfonamide. Also it can occur because of some infection, especially herpes simplex virus, then mycoplasma, infectious mononucleosis, or even sarcoidosis. Now let's talk about the epidemiology. Now age, it usually is seen in second and third decade. It has a slight male predilection. Then in the location, it is usually seen in the arms, the legs, face, neck, and the oral cavity. Now first in the clinical presentation is what we see is prodromal symptoms. Now in these, what you get to see is, as usual, fever, malaise, headache, then sore throat, cough, rhinorrhea. Then the hallmark of the erythema multiforme lesion is that it is always going to be raised. Okay. Now in the skin, it is present in several forms, but there is one characteristic form in which what we see is that there is a central area of central blister, area of central blister, or there is necrosis, and this area, it is surrounded by concentric rings of variable hue around it. Now this is the reason why it is called as target or iris lesion. Now suppose like a target is something like this, right? So that is why it is called as target lesion. Now histopathology is very important to remember. Also, I'll give you some mnemonic to remember it well. So just remember SIP and DEL. So by S we have subepidermal vesicle, I intraepithelial edema, P, we have uh, the infiltration. That is, there is going to be the persistent or the there is going to be the infiltration. Yes, there is going to be perivascular infiltration of lymphocytes. Then D is standing for the dilation, dilatation of the vessels. Then E stands for the edema of superficial connective tissue. Then L stands for liquefactive degeneration of upper layers of intraepithelial vesicle. All right. Now, oral manifestations, I forgot to mention it before, so I'll mention it now. So, oral manifestations, you get to see a lot at a lot of sites like lips, buccal mucosa, tongue, floor of mouth, gingiva. Now, what happens is it initially starts as an erythematous macule. They later on form the vesicles and bullae. Now these vesicles and bullae, they erupt. They basically, yeah, they just burst, and then they lead to the formation of a pseudo membrane. Then there are ill-defined ulcers. Also, in cases there is extreme involvement of lip. All right. Now coming on to the treatment. Now in treatment, first we have mild and then we have the severe cases. Now in mild, as I mentioned in the definition, you must be remembering that it is self-limiting. So it will resolve on its own. But in severe cases, we have to give the systemic and the topical corticosteroids. Also, if the it is associated with herpes simplex virus, then we must give an antiviral. Then sometimes we also give some immunosuppressant drugs and other treatment modalities that include azathioprine, dapsone, then methotrexate, hydroxychloroquine. So this completes the erythema multiforme. Yeah, but I forgot to draw the diagram. Just give me a second.